So good morning, everybody. It is really great to see you all here. And before we get started, I'd like to ask Ed McCabe to come up and lead us in the Pledge of Allegiance, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ed. Well, good morning. I want to welcome everybody here to our town hall where we can discuss the implementation of the PACT Act. As you all know, that was a bipartisan piece of legislation that passed last year that really is the next very important step in making sure that people who have served our country and sacrificed so much for all of us have the care for health care problems, for medical conditions that are service related. And I was very proud to support the bill. I was very proud that it was such a strong bipartisan bill. And I am grateful to all of you for being here, because one of the purposes of today is to really get the word out about what the PACT Act is and encourage people to reach out to the VA and register under the PACT Act, even if they still aren't sure that their condition is covered or whether they qualify. This is the time for veterans to reach out to the VA. And with that, I have a great panel here with me. Just starting at this end of the table, we have Steve Miska, who is from the National VA office, from the Veteran Benefits Administration. We have Ina Lima, who is, sorry?
I said good morning.
Good morning. Good morning to you, who is part of our team at the Manchester VA. Kevin Forrest, who I think many of you know, who directs the Manchester VA. I am very, very grateful to all of you for your work and also for being here this morning. Mostly, though, I want to just thank the veterans who are here today. Thank you for your service. It can never go without saying that we owe you everything as Americans. We owe you a debt that we can't fully repay, but it is up to us every day to try and to make sure that our country is ever worthy of your service. The PACT Act is an important step in recognizing that obligation, and I want to be really, really clear. We wouldn't have achieved the PACT Act, we wouldn't have gotten it passed, we wouldn't have gotten it implemented as quickly as it has been, although one of the things we'll talk about today is that there's still work to do in that front. But we wouldn't have gotten here without the advocacy of veterans. Veterans in New Hampshire, veterans across the country. One of the things that I'm always impressed by, although not surprised by, is that veterans who have served our country with such passion and commitment and get home and leave service and become veterans never stop caring about their country and doing their part. And so I have seen the difference that the advocacy of New Hampshire veterans makes, and it certainly made a big difference in getting the PACT Act over the finish line. Now what our job is to raise awareness and make sure that veterans know about the benefits that they can receive. And among the things that I'm hoping to make sure people get the word out about today is that we have an upcoming deadline for veterans who served between 9/11 and 2013 in terms of registering for health care under the PACT Act. And the panel here can talk more about that, but I want people to be aware of it. And again, really encourage people, if you aren't sure whether you qualify for benefits under the PACT Act, don't guess, reach out to the VA and they can help sort things out. You also can register under the PACT Act and get testing, screening over time, which is going to be really important moving forward. I hope that we can answer questions today about the implementation of the PACT Act. I have a lot of Team Hassan from our state office here today. Jen Kuzma in the back is my state director. I think a lot of you know Justin Triano, who specializes in veterans cases and matters, from everything from policy to helping veterans with a question. Ben Belanger is here. He's our North Country representative. Elise Britton directs my constituent service team, and Carrie Zach is here as well, who's one of my policy folks. And Rachel is back here, also part of constituent services. So as we will have a discussion today, but if you guys have specific cases, specific questions that you want to get to my team at any point today, please reach out to one of them. And with that, I am going to turn this over to the VA and particularly the benefits folks who are here, and ask them to say a few words. We're going to start with Kevin, the director of the Manchester VAMC.
Well, thank you, Senator Hassan. So, welcome everybody. It's great to see familiar faces, and I've got to say that the PACT Act has just had such a wonderful impact on the Manchester VA and the veterans throughout New Hampshire, and we've been really, really busy, and I say busy in a good way. Our facility, many of you know, is challenged, and we've had, with Senator Hassan's help and the Secretary's help, a lot of money coming in to deal with aging infrastructure, which many of you are familiar with, but also new facilities that are coming in that, to support veteran health care in the future, and that doesn't happen by accident. In the PACT Act, and actually advanced, abilities with contracting and things, so it really made it much easier for us than it had in the past. From a staffing perspective, the Manchester VA is in just such a much better place than when I first started some years ago. The VA, out of the VA New England healthcare system this year, the Manchester VA had the highest growth in staff added than any other facility in New England, almost 10% increase in full-time equivalent staff. And I credit, Dr. Zwolak, our chief of staff, who's a, certainly world-renowned vascular surgeon and certainly known through the Dartmouth community and here in New Hampshire, of just having a wonderful network of bringing some of the best top physicians in and joining our team. And a lot of that was also, due to the PACT Act and being able to have comparable salaries and other things to attract top talent to the VA. So, it's just been wonderful all around to be able to provide better access, to care for veterans with that. And then as far as the PACT Act and for veterans coming in, we did almost 200 engagements this year focused on educating the public and our veteran community on PACT Act benefits. Since the beginning of law last fall, our monthly average enrollment of new veterans coming into the system was about 20% higher than before. And so, like Senator Hassan had mentioned, we go out, we advertise, and we market the PACT Act, and we go to events, and my biggest thing is just trying to say, just if you haven't engaged with the VA before, come call us and let us, figure out and welcome you to the Manchester VA family. So I look forward to the panel today.
Thank you very much, Kevin. Next, so we're going from Manchester to our regional VA representative. Ina Lima is the regional director for the Veterans Benefits Administration, and you're going to provide an update on VBA and how people file claims, right?
Yes, ma'am. Yeah. Yes, thank you. Good morning, everyone. Just like Kevin just described at VBA, this has been an outstanding year for us as well in terms of our interactions with veterans and their family members and their survivors as well. As a result of this, on a national level, we have been able to have filed more than 1 million claims related to PACT this year, and we've completed over 500,000 claims this year so far and paid out over $2 billion in benefits retroactively to veterans and survivors. And so our impact through PACT has been really important. Also, as far as hiring goes, we have also staffed up over 20% this past fiscal year. Looking ahead into next fiscal year, we're going to continue hiring more claims processors as well to support this process. I feel that they say it takes a village, and it is very true. It's not only just the staff and hiring that we've done, but also the partnerships that we've built in the community to be able to help amplify the message of VBA. We have done a lot of outreach this fiscal year. We have been able, through our catchment area, been able to see over 1,500 veterans this fiscal year and help them be able to learn more about PACT and be able to file claims. Here in New Hampshire, we have completed over 2,000 claims thus far this fiscal year, and we paid out over $8 million in retroactive benefits. So again, a big impact through PACT in this particular area. So thank you so much this morning, and looking forward to engaging with you further on this.
Well, thank you very much. And next we have Steve Miska, who is the Transitional Executive Director for the PACT Act with the VA. So welcome, Steve.
Thank you, Senator. Thank you for having me today. I am the Secretary's Senior Advisor for all things PACT implementation. And so he regrets he could not join us in person, but he sends me sometimes to do those events. I'm a veteran. I spent 25 years in the Army infantry, 40 months in combat, definitely exposed to lots of toxic substances. I retired in 2015. When I did that, I intentionally chose VA healthcare, and I do not regret that decision whatsoever. And I had people advising me not to go to the VA at that time, to include people who were very close to me, because they had heard stories about VA healthcare. But I'm here to tell you the healthcare that Kevin and his team at the hospital provide is the most culturally competent healthcare you will get in the world for veterans. You will have a team approach. You'll have doctors who understand toxic exposure. Ina mentioned how many claims we've gotten. On the healthcare side of things, we've screened already 4.5 million veterans since October 2022. That's about half of the veterans that are in our system. So we've still got a long way to go, but there's 18 million veterans in the country. And what the PACT Act did is it opened the aperture to so many more veterans than have been in the VA system before. And it opens that opportunity to get that quality health care that you're just not going to find elsewhere. So I would urge you to give us a chance if you haven't. You might also not know that the PACT Act applies to survivors in some cases. So say there's a family member of a Vietnam veteran who passed away from some sort of toxic exposure that is now eligible, thanks to the law, for presumptive condition. Those survivors can apply and possibly receive benefits as a result. So you might know some of them, and so please ask them to give us a call. And I'm sure Ina's team will be willing to look into it and help them work through a claims process. We are doing this very aggressively with respect to outreach. You've heard some of the events across the country. It has just been very dynamic. All of our hospitals, all of our regional offices for benefits, on the airwaves, with public service announcements, with our members of Congress helping to host events like this. We are just really trying to get the word out and give all veterans a chance to apply for benefits and enroll in healthcare. And so if you've got questions, we'd love to hear them today. I am really grateful to be able to be here. I'm originally from Long Island, so not too far away. And so it's nice to be able to come back and visit sometimes.
And see the beginning of the leaves change.
Exactly.
Yes. Do you want to talk just a little bit about the September 30th deadline, just specifically what that is?
Sure. So the law allowed for what's called a special enrollment period. For basically what the law did was it expanded from 5 years after leaving service if you're a combat veteran to 10 years. And so if you think about post 9/11 veterans, if they got out in 2002, well, they've already exceeded that 10-year window. So the law put this special enrollment period in between 2001 and 2013, as the Senator mentioned, and that allows those veterans in that cohort to apply for health care and enroll. A lot of veterans don't think they need it, right? And at that age, right there, they have other alternatives. But what I'm here to say is that our doctors, the VA doctors, are the best in the world at identifying the markers that could manifest decades down the road in life. And I had a gentleman in North Carolina, I was speaking in Durham with Dr. Elma Hall, who's the Undersecretary for Health. And a gentleman stood up and was with the VFW, and he said, you know, I've been to 6 different doctors in the private sector, and I knew something was wrong with me, I just didn't know what, and they didn't diagnose anything. And when I filed my PACT claim and I came in, the first VA doctor I saw realized that I had pancreatic cancer. And we're lucky he is here today, because pancreatic cancer is really dynamic and nasty. But he's still alive, and he credits that to the VA doctor he was able to see.
Thank you very much. Well, I want to thank the panelists for those introductory remarks. And now what we really want to do is open this up. So Justin and Ben both have microphones, and if people have a question, just raise your hand and we'll take them in order. Mike, it's good to see you.
Forgive me, getting up, my leg is hurting. Anyways, question that I run into a lot, and maybe Kevin can help me out. And that's, what kind of a test are we talking about? Does it have to be specific in the issue that the veteran has, or is it a test of everything? Because what I have from veterans, they say, well, I don't have anything right now, but I was in the theater.
Yeah.
How do you answer that?
So Mike, we have the toxic exposure screen, which every veteran undergoes. I underwent mine, and it's a series of questions of, were you exposed to certain substances, yes or no, and were you in certain areas in theater? And it kind of cascades from there, with your physician that's going through the toxic exposure screen, and that's really the starting point for further kind of discussions and analysis of what your healthcare plan may be. The one story that I think about, one of our physicians was doing a toxic exposure screen on a Vietnam veteran, and the Vietnam veteran who went through the toxic exposure screen mentioned, he goes, this line of questioning that you just gave me, I started to think about things that I really didn't associate with toxic exposure, but it took me going through this line of questioning to kind of have an epiphany there, and that's what that screen is designed to do, is really to prompt, a lot of exposures in geographical regions and things that the folks have been in, so that we can, take care of folks in a better manner. Does that answer the question there? Okay.
And I would add too that one of the provisions in the law sets up a mechanism now for the VA and scientists to continue to study different kinds of exposures and different kinds of conditions to determine whether those conditions should be presumptively, connected to service. So we've got, if you don't see a particular condition listed, it doesn't mean, first of all, that you shouldn't sign up and ask, because not every single thing can be listed. But secondly, one of the reasons to engage and go through this kind of screening process is we have a dynamic system set up to keep studying the science, and it will allow us to add more conditions moving forward if the science determines that it's the right thing to do.
Yeah, we're currently researching chronic and acute leukemia as well as multiple myeloma. And there's a ton of scientific evidence out there about the presumptive process is what it's called, and it gets reviewed by the National Academy of Sciences in order to make sure that it's legitimate throughout medical research and academia. But once the evidence is reviewed, it'll tee up a process where should the exposures that are researched link to, say, acute leukemia, then we can tee up a recommendation for the secretary to make that a new presumptive. And as long as the scientific evidence is strong, and he can make that decision.
Just to add, so, of the 30,000 plus veterans that we serve here in New Hampshire that enrolled, we're right on the cusp of 19,000 toxic exposure screens. So we're over the halfway point of screening, and roughly 40 to 50% of those have triggered secondary questions for screens. So, the tool, works in trying to, get that information out. And then as, when you get a secondary screen requirement, we have 30 days really to complete that secondary screen. That's our target. And of all those secondary screens we've done, none have exceeded the 30-day window there. So, regardless of your point of entry, whether it's a primary care appointment or others, they're supposed to look and see, like, hey, has that screen been done on you, yes or no, and then move forward from there.
Yeah, Rick. Oh, whoops. Yeah, wait a second.
Are there any plans to educate the New Hampshire Medical Society? In New Hampshire, we have Just Ask, right?
Right.
Are you a veteran? I'm a retired military physician, so that question is pretty much obvious, right? It's part of doing your occupational history for civilian physicians. Do you have any plans in connecting with the New Hampshire Medical Society to offer maybe 1 hour of CME on history, Agent Orange, toxic pits, Chembio, etc.?
I'm going to let Kevin start.
I'll take, that is a wonderful suggestion. So I sit, with the New Hampshire Hospital Association, as does our chief of staff. Right now, there isn't a deliberate plan of some type of CME, but we spend enough time there, like in October as we go up for the annual meeting. I'm gonna take that, especially with our community care providers out there that also see veterans, and I think that's just a wonderful idea for some type of deliberate PACT Act related education.
It's an operational concept, right? My dad was a World War II vet, Navy, asbestosis. Because I was the chief of the Warrior Transition Division before retiring, and because I was involved in transitioning troops to the VA,
Yeah.
I finally took his package up to Concord for asbestosis, Navy related. So if we don't educate our primary care physicians and our New Hampshire Medical Society, then everybody here is a vet, so we try to get ourselves educated, but we have to educate in order to grab the young people and the people who don't understand comp and entry to the VA. The hardest part about VA medicine for the troops is walking through the door. And like the
Steve,
veterans
yeah.
on the panel mentioned, I'm a retired military physician, but I greatly appreciate the Manchester VA system. I was employed in the medical system after I retired, so kudos to you.
No, thank you so much. And, while I know the training that we have done out in the community, and we're reliant on community providers, they're part of our team, is military cultural competence and understanding a little bit about veterans as they go, out and seek care in the community. But I think, what you mentioned is really kind of the next level of that. And it's, thank you for that.
Good morning, and thank you for all being here. We have almost 100,000 veterans in New Hampshire. And as you said, Kevin, we're only reaching about 30,000 of them right now. So what are the plans to educate the veterans that are out there that we haven't reached? And the other thing is, with all the different veteran service organizations, we need more education as well. So that way when we're talking to veterans, we know the questions to ask to steer them towards what they really need. How is that going to be accomplished?
So we, continue with our outreach program. I had mentioned, 193 outreach events that we had done this year, in addition to marketing and the other things that we, routinely do. So we've got, 30,000 or so enrolled to Manchester. There's another 10,000 enrolled up at White River Junction for those veterans up in the, Connecticut River Valley out there. But you're right. I mean, that leaves a gap of folks, and that's where our advertisement and marketing is being geared. We've done direct mailings, Rick, especially for those that we identified that were combat veterans that we didn't have on the rolls and enrolled, and do direct mailings out to them, like with the September 30th, suspense date for enrolling in VHA healthcare. But it never ends. And it's not to say that everybody is eligible for enrollment, but we need to make sure that we touch every single person so that they can make an informed decision for themselves.
But what about educating the VSOs?
We can, certainly educate VSOs as an extension of our outreach. And, if folks have ideas of what types of education, and we certainly have our standard outreach education that we can do, but if there's other types of things, that's bi-directional. We're certainly interested in how we can reach every single veteran.
Go ahead.
No, I was going to say on the VBA side, we have looking into this coming fiscal year, looking for those opportunities to do outreach in areas that I would call non-traditional. And typically, this past fiscal year, Steve described it, we were really joined at the hip with VHA to do a lot of our outreach. So wherever Kevin, for example, may have had an outreach event, there were members of my staff present there as well to support those. But we also still have a lot of parts in our catchment area that are still underserved or underrepresented. And so we're trying to figure out how to partner. And some of that may be, working with community partners that we typically may not have partnered with in the past, whether it be an employer or other, organizations that are willing to have us there to be able to partner with us and allow us to have that. As far as your question on training, VBA typically does work with the service organizations to provide training support in particular targeted areas. So if DAV has like an upcoming training conference that you'd like to invite us to, please let us know. We do support those type of events and are able to provide targeted training if it's necessary for VSOs out in the community. And we do include that as part of our local training efforts at the regional offices.
The one other question I have is what is the leadership looking at for other chemicals that they're going to be adding to the PACT Act or pursuing?
Steve, I'll let you take that one in.
Yeah, we are constantly doing surveillance of exposures. So it could be everything from radiation to other types of exposures that were not included in the law, but because the presumptive process is part of the law and it's dynamic, we will continue to look at all locations, look at conditions coming in, to include, we've gone back through previous claims that have come in through VBA that were denied, and our researchers are looking at those claims based on conditions that were being manifesting for people that might not have been, we didn't by law, we weren't able to give them benefits at the time, but we might be able to do that in the future. And so we're continuing to try to open up the aperture. Our goal is for every veteran to be in VA healthcare and to receive the benefits that they've earned.
And I will add that there is advocacy in Congress, for instance, to add the location of Kosovo to the list of locations where toxic exposures occurred. So we're trying to deal with both locations that weren't originally included as well as substances, and we continue to advocate. You know, it's pretty clear that Kosovo was a location where people were exposed, and we believe under the law it could be added. So we continue to need feedback from all of you about that. The other thing I'll just say, it doesn't address the upcoming September 30th deadline, but we, following the Legion's lead, we passed a law that now requires the Veterans Administration to stand up at least 2 buddy weeks a year of peer-to-peer counseling. That's going to be October 16th to the 20th this year. It's another way for us to reach out to veterans and let them know about the changes in eligibility and the changes in the law. And the other thing that we've been focused on is women veterans in particular, and there's something called the Women Veterans Network, or WOVEN, which is a relatively new organization that we're trying to make women veterans aware of, because they often feel kind of that they don't know who their peers are.
I'd like just to add one more piece on the research. So there's another program in the VA called the Million Veteran Program. Perhaps some of you have heard of that. You know, we just added our MVP, as it's known, resource in the Manchester VA, again, post-pandemic. But, you know, the VA is almost up to 1 million samples from service members from all generations. And to have that as a basis for research of 1 million samples from service members, you know, from different geographical areas and questions, it is just really awesome. There are research entities that would love to have that as a footprint to do research, and I see that interconnected with being able to do research on things like, you know, other presumptive conditions and things that are out there. And so I guess my ask would be, if you're a veteran and you're getting your care at the Manchester VA or at a VA and you're not part of the Million Veteran Program or haven't donated a sample, it's a wonderful time to do that and help us reach that 1 million sample goal, really for the purposes of doing this research.
Good morning. Thank you for being here. So my question's a little bit different because, you know, anecdotally, when I talk to other veterans, the one unique aspect of recent operations is that we've used more Guard and Reserve in this operation than we have in any prior operation. And as a result, New Hampshire, being a Guard state and having a lot of part-time Guard and Reserves, they have jobs when they come home, and with those jobs, a lot of times they have medical coverage. So in those circumstances where veterans already have a doctor, they have a relationship with a doctor on the civilian side, and now you're trying to get those very same veterans into the VA system. My question is how do you present this to them so that they're not thinking, I have to go to the VA in lieu of my doctor instead of in addition to my doctor? Because I think we're really looking at more of a team approach here, if I'm not mistaken, correct? And I think sometimes the word that I hear is, come to the VA, you'll get your care here and everything else, and they're like, yeah, but I don't really want to change my current doctor. So how do I do both?
So Dave, you know, to me, it's really getting them in the door and sitting down with enrollment and eligibility and starting with that conversation. We have veterans, you know, that use care in the VA as well as in the community. And you know, we're not into fracturing relationships that people have had for, you know, for a long time, but we are interested in providing just more integrated veteran-centric care that perhaps doesn't exist out in the community. And I guess, you know, my message to a veteran in that situation message is, you know, perhaps you don't need that care today or you're taken care of, but that may not always be the case. And to be enrolled in the VA and have an established relationship makes it so much easier that when you do need to call on us, that relationship is established rather than doing it at a time of crisis. And you know, honestly, as a you know, VA employee, that's what took me to come in and originally enroll in the VA, and I was medical, and so I understand kind of the marketing piece that you mentioned.
got lots of.
Hi, thank you for being here. Back when I retired from the Air Force in '90, I went to the Bedford VA for dental. And at that time, I was told I had no reason or to enroll in VA because I had no disabilities. Now, back in 2017, I believe it was, at the New Hampshire Guard, they had this big activity, military activity, and that's where I first learned about the Agent Orange and so on, having been a Vietnam veteran. You talk about this toxicology screening. I have nothing about it. My only contact with the VA is at the end of the month or beginning of the month when I get my disability check. I have no other contact with the VA. And I think that's sorely missing. I have not seen anything on TV about the VA, about the PACT Act, and even how it affects the Vietnam veterans. And I think that is sorely missing. We've got WMUR, we've got NHPR, and those are reaching this state, yet I see nothing on there. And now I've been dealing under the PACT Act now for over a year for a simple thing that is presumptive, but I'm running through the mill trying to get things done. And I don't think that's right. Now, this toxicology screening, news to me.
I'm going to let the VA folks answer some of the specifics, but I appreciate the comment very much. We have been trying to get the word out. The VA has, but there's obviously a lot more to do. And I also want to make sure that after we conclude this today, that you get some individual outreach just to understand more fully what your situation is. But it has been, it is a challenge getting the word out for a variety of reasons. I know the VA has been increasing its efforts to amplify, but I'll leave it to the folks here from the VA if you want to add to that.
Yeah, I mean, I always say for VA services, I don't think we can ever advertise our market enough, whether it's nationally or locally. And, when I look at, the almost 19,000 toxic exposure screens we've done so far, that started to plateau a little bit, and now it's getting to that population that's tougher to reach, which I guess we need to do even more aggressive marketing to bring that home. So I hear you, and thanks, and I want to make sure that, yes, after that we want you connected with us and certainly give you, all the care and screening and services that you've earned and need.
And one of the reasons, too, that we have members of the press here, including WMUR, is to get coverage for this so that it will reach more people. But we've obviously got more work to do.
Yeah, I would just say, September 30th is right around the corner, and we're very focused on that cohort. But the message is very clear, and we have no intention of taking our foot off the gas with respect to trying to reach every veteran. Of that particular cohort, there's 1.7 million veterans that fall in that 12-year window. We already have 1.3 million enrolled in VA healthcare, so we're working on those other 400,000 that probably have an established relationship with their doctor. They wonder, why do I need VA healthcare? But it's for the exact point that you make. It's because you need to get the screening that is going to help identify potential serious conditions down the road and identify them early enough to be proactive about it. And so I'll give you some insight into the way we are going about this campaign is very much not just over the airwaves and via email directly, but direct mail to people's homes. We're also, we just did the first text campaign in VA history and texted the September 30th cohort, but once we're done with September 30th, we're switching to a broader aperture. and working on the other cohorts that are out there and trying to reach those veterans who are eligible and they just don't know about it. And I would put one more plug in to for survivors, because a lot of survivors don't even identify that way, right?
Right.
And what is so meaningful when they do finally get this closure that my service member's service is being recognized by our government for the conditions that he or she suffered with and probably passed away from. It's a really meaningful thing, and they're not even worried about the money. It's the acknowledgement of that service and how important that is. And so we're just, I think the senator said it best, you know, we're going to keep doing as much as we can, you know, my colleague at the end of the table said no amount of marketing is enough. But that's why we're asking our VSO colleagues, that's why we're asking all of you to reach out to those veterans that you know and try to help us get the word out.
Good morning. My name is Wayne Barr. I'm the Department Adjutant for the State of New Hampshire American Legion. At this point in time, we have one individual, and we're a small state with a large veteran population. The American Legion right now has one service officer to take care of the entire state. He currently handles a little more than 1,000 cases, active cases at this time. Is there a program in place for grants that may allow us to bring in additional staff to handle those cases? And if there is not one presently, are there plans for some type of program to bring in additional help?
I don't know about grants but I do know that our colleagues in the Veteran Benefits Administration do training for VSOs to help with filing claims. Now that the challenge is right now, because PACT expanded so much, we have been hiring, and a lot of your service officers end up coming to work for us because we're hiring, right? But we want to partner with you. And so we do training. I don't know if you've done any locally here.
We do local training, but I think my recommendation would be working through your leadership core to determine how can you recruit more officers coming in, and then working with VA to get them accredited so that they can represent more veterans. A lot of the service organizations, like Steve just described, had suffered, particularly post-COVID, a lot of losses in terms of staffing overall, and it's not just unique to the Legion, it's all across the board. All the service officers, whether it be the mass hiring VA was doing has really impacted some of that, but also just, economics. There's been a lot of folks that had retired, and so that has left some big gaps at all the service organizations as they're trying to provide that level of service, particularly with the increase in demand. It's not only impacting the local regional offices, but of course they're coming to you as well sometimes as their first stop. But if you're able to recruit more staffing that way, the VBA can help with getting them trained and accredited to be able to represent veterans out in the community. And it's not a very lengthy process. It's just really basic training on claims processing that's provided to the service officers. The local regional offices then can provide additional support throughout the year.
And I will just add that it sounds like a good idea, so let's talk a little bit more about whether there are legislative ways we could advance that idea. Okay.
Thank you, Senator, for hosting this town hall. And I'm a civilian here in New Hampshire. I'm quite humbled to be amongst all the veterans here and veterans' families as well. I'm a civilian, and I am from the psychiatric mental health sector here in New Hampshire. And as a private practitioner, I work a lot with veterans and their families, their children, and many of them ask me about PACT, about ACT, and about the VA. And kind of piggybacking on the doc there, I think it would be amazing if we could have some training with the New Hampshire Psychological Association, because my colleagues with good hearts still are not consistent in even asking in an intake if someone has served or someone in their family has served. So I think we've got a lot of work to do. What do you suggest? What's the best way for private practitioners to talk with their patients, their clients about this?
Well, I think, that just asking the question right up front, are you a veteran, yes or no? I think that's really your obligation. After that, I think it's us giving you the right contacts to either provide to them or let us know, and so we can, be an intermediary and assisting the veteran with whatever help, that they need. The other thing is, from Optum, our third-party contractor, for which we use, for all of our community care out there in the community, is leveraging them as they sign up, different groups and providers throughout the state, and see what they can also provide, and have really a two-pronged approach from the third-party contractor as well as from the VA to provide whatever education is necessary. I think it's important, as I've written this down, it's really a needs assessment. It may be one thing of what I think people need, but it goes both ways of, what are the things that you're seeing that you would like answered, and I think this is a great discussion and something we need to just mature and move forward with.
My colleagues don't seem to even know the suicide rates. I mean, they have good hearts, they're well trained, and they're trying to do the best thing they can for our veterans and their families. But those suicide rates, accessibility, availability is really a great concern to me. And I'm just one spokesperson here, but I would really very much appreciate further discussion about how we might intersect.
I know the one thing, specifically in the mental health arena, we're very fortunate to have a robust suicide outreach network. And one gentleman that we have working for the VA, his sole job is outreach for suicide prevention and establishing these community coalitions throughout the state. Like there's a big one in Laconia. They're working on the Seacoast. There's 6 established so far, with 5 more in the queue, with other community providers in groups, not just direct care providers, to educate and to let people know what resources are available. And so, I think that's the start. But having the interest out there and folks knowing and being able to join those coalitions is critical. So I'm excited about this. I think it
Speaking about Justin.
Excuse me?
Justin Lawrence?
Yes, Justin.
Yeah.
And so a lot of opportunity.
Well, and Laura, I'll just add one thank you for the holiday card challenge, and we're revving up for it again. But this is also an opportunity to remind people that if you call the mental health crisis hotline, a national hotline that's been in place now for over a year, 988, there's an option 1 which is specific to veterans, and we just want to get the word out about that. I don't have the exact figure in front of me, but I believe the wait time for getting a live human on the other end of that line is under a minute now. So I just, again, encourage people to share that.
Yeah, and just to let people know, out of the thousands of calls nationwide that go into those call centers, we probably receive, 40 veteran calls that are direct referrals back to us of veterans in crisis that we do follow-up care on. So that 988 Veterans Crisis Line is a key part of our mental health services to veterans in New Hampshire.
Thank you very much. Thank you all for coming. I really appreciate this. And if you haven't signed the holiday cards for everybody, go see Laura. If you don't know what it is, if you're visiting, you need to learn.
That's right.
All right. So, piggybacking on some of the comments about veterans who are afraid to come, number one, I'm glad that I go to the Manchester VA. My soldiers that I am on Facebook with, if they live in New Mexico and Arizona, terrible time. I can tell you about it later. The question though is, why should I bother to do this? If I read correctly in the news, 1 out of 3 veterans who've been going for PACT Act have been rejected. So it's like, if I don't really have any problems, or I think I don't have any problems, why should I bother? And that, I think, is what is holding back many veterans who should be going. I'm not sure why the 1 out of 3 is done. And then the other is, how long will it take? Is there an estimate? If
if I went in today and put in for the PACT Act, how long before a decision is made? That's basically my question.
So, well, first off, our approval rate for PACT Act claims is currently at 79%. So I'm not sure, I'd love to know the source that you're citing there, so that we could reach out and understand more of where that data is coming from.
Military.com, check that out. We have
Okay.
articles on it.
What you might be seeing is stats around if somebody does file a claim, that they get a 0% rating. And so that is something that happens frequently, and there can be multiple conditions that are coded at 0% initially that could manifest into more life-altering conditions down the road that would then qualify for higher percentages of disability. So that's on the disability side, but with respect to the healthcare side, I am not aware of statistics of people being turned away.
I think it's what you mentioned, that 1 out of 3 are getting 0.
Yeah.
So to a veteran, 0 sounds like, well,
Yeah.
I don't get anything. I understand, but most veterans who are not engrossed in all this don't
Right.
understand,
Yeah.
0 means still, hey, you're in the system. That's important.
Exactly, and so this is a question that comes up frequently. And number one, like, I'm sure I've got multiple zeros in whatever the myriad of conditions are that I have. What could happen, let's take hypertension, for example, which frequently has a 0% rating, but it can manifest into other conditions, secondary conditions that could be life-threatening. And the fact that your doctor at the hospital is tracking that and looking for those markers is really important, and those other conditions could then qualify on the benefit side for upgrades in your rating.
Right, but the average veteran
Right.
doesn't know that. That's what, we gotta
Yeah.
conquer
Right.
that.
Yep, I agree.
And then how long before, I'm in this PACT Act, how long before I hear that something's been decided, whether good or bad, I don't care.
So, yeah, that's a good question. Our goal is 125 days for a claim that is processed. If you're enrolling in healthcare, we want you to have an answer, ideally same day, but no later than within a week. And so if you apply for healthcare on va.gov, that can happen same day because it's all automated. On the claims side, however, it depends on the complexity of your claims, because you could have conditions that require exams. It requires research for our reviewers to dig into. Now we're trying to speed that process up, and the PACT Act actually gave us resources to invest in more automation, particularly on the benefits side. And so we're looking to see the results of that as that automation comes online. But we're taking a very intentional approach because we rely on human-centered design, which means we're never going to take the human being out of the system with respect to making a decision about veterans. And so automation helps them be more efficient in their job, but we want to make sure we always have a human being making that final determination.
Thank you.
So thank you for the question, and I see you jumped out of perfectly good airplanes too.
That's because I haven't seen a perfectly good Air Force plane, sorry.
Never do it. We have time for about one more.
Okay. Rick has another one, so let's go ahead.
The spirit of the PACT Act is great, okay, but it doesn't address a lot of things that are going on with the veterans throughout the country. One of them, and we've spoken about this before, Senator, is the forever chemicals. Many of our bases have been declared Superfund sites. Cancer is a known result of that. What is Congress and Senate doing about that?
The forever chemicals are in fact a real health threat, and we need to deal with them both on military bases and in the civilian world too. So just taking a step back, in the infrastructure bill, we set aside funding for research and cleanup. We continue to push the Department of Defense to study in various areas so that they can develop their appropriate cleanup plans. And we continue to push for funding both on the Armed Services Committee and throughout Congress. And so we will continue to focus on that. One of the big steps forward that the administration has made is that the EPA has come up with some standards for levels of at least some of the forever chemicals. Before, we didn't have a standard, which made it very difficult to insist that companies do a certain level of cleanup. Now we do. So that's a step forward, but there's a lot more work to do. And again, I encourage people who believe they've been impacted by forever chemicals to come forward to talk with the VA about it. It's really, really important.
Are those chemicals going to be added to the list of hazardous chemicals?
Yeah, our researchers are working along with other government researchers in Health and Human Services, Department of Defense, and others on the health side to examine forever chemicals, and where the scientific evidence shows that those chemicals are linked to certain conditions like cancers that you referred to, then we can take those recommendations to the Secretary and he can determine that they could be presumptive.
So we are gathering the science to make the case, and given my understanding of the impact of these chemicals, I'm hopeful we will have the evidence soon. Anybody else before we close up? Look, I thank you as... Oh, was there one more? Yes, sir. Sorry.
I think I can talk loud enough. I just have one question. Keep on talking about opening the aperture for veterans to be eligible to come in. Why is it that veterans, any veteran, is denied sometimes because of means testing? I mean, I had a personal friend, for example, that his wife retired. When she retired, he lost his medical care. She made too much, so they didn't qualify in the means act. And this guy eventually wound up dying from heart conditions and stuff that he could not get medical care for because he had no insurance to cover him on that. I think it's a shame that, we have veterans who serve, who are denied because they happen to be making more money than what the cutoff is. Is there any thought about opening that up?
Yeah, so the law looked at, it cascaded out groups of veterans, cohorts of veterans over a 10-year period. What we were concerned about was that if the aperture was opened up too quickly, then our hospitals, which are already in many cases at capacity, would not have enough time to expand their capacity, hire the appropriate staff, and so we needed a little bit of time. What we did on the benefits side was we immediately made the decision early on to open up benefits so that veterans could apply for benefits. But the healthcare side is a little bit more complicated due to capacity constraints. And as Kevin mentioned earlier, the age of our infrastructure and the need to renovate or rebuild or find new partnerships so that we could lease the capacity that we needed. That decision is being considered for whether or not we open up the aperture anyway and just try to deal with it. But the challenge that leads us to is one of access for everybody, right? Because if you have your healthcare at the facility here in Manchester, and all of a sudden it goes from, did you say 30,000 to 60,000, that's going to create a problem with wait times, and it might push people out into the community providers who aren't necessarily well versed, as we've heard, on how to deal with these things. And so that's the challenge to that question. But our goal is for all veterans to be eligible for VA healthcare. That's what the secretary has said publicly. That's what the leadership believes, and that's what we're trying to work to. But it's going to take us a little bit of time to get there.
And I would just add that there is a group of us in Congress pushing very hard for new building, new facilities, permanent funding for infrastructure so we can increase capacity. The other thing I would just want to say is if anybody, veteran or non-veteran, is struggling to afford health insurance or health care, I hope you will reach out to my office. Because we cannot promise that we can fix every situation, but there are options out there. We do have contacts at the VA. We do know what possible options for coverage there are for individuals in New Hampshire, and I really would encourage people to call my office, ask to speak to a constituent service rep, and we will do our very best to make sure that people get the health care they need.
If I could just add one quick thing. This gentleman here, I can sympathize with him. I'm at the VA, it seems like at least once or twice a month.
Yep.
Okay? This is the first time I have ever heard anything about that toxin screening.
Okay.
And I'm also Vietnam vet. I was in 72, 75. And this was a godsend to me, because I'll tell you, I'm going to be putting in for it.
Well, I'm really glad to all the Vietnam veterans here. Welcome home. Anything else? My team is looking nervous because I'm supposed to be in DC in a little bit, so I have a plane to catch. So I'm going to honor their body language, which is telling me it's time to go. But look, I want to thank everybody for participating. I want to thank the panelists here, not only for being here today, but for everything you do, and for bringing such a veteran-centric focus to your work, because that is what it's all about. I know we have more work to do, and thank you for your questions and your insights about the ways the system works and the way it needs to improve. And thank you again for your service to our country, for the sacrifices you and your families have made, and for your continued care for the United States of America. Thanks, everybody.